See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist, Shauna Butler.
When you experience discrimination in a primary care setting, you're much less likely to go back there. That initial discrimination has had a compounding effect where discrimination happens in one part of life. It compounds to other parts of their life, to housing discrimination, to employment discrimination, to any type of public accommodation. Affirming care is being able to care for those complex, disparate, different parts of one's life. In short, it's what nurses do best. It's being holistic. At the core of all this, especially in a mission-driven organization, the first and most important thing is to be able to have the trust of our community through expert clinical care and through the partnerships that we create. It's really working to create a healthcare system that is responsive to one's identity.
Welcome to See You Now. I'm Shauna Butler. COVID-19 precipitated an avalanche of health crises that included disruption to care, delays in care, and exposed in no uncertain terms the disparities in our healthcare systems, our healthcare services, and our health outcomes. Disparities which have landed far more heavily on our under-resourced and our most marginalized citizens and communities. And while the pandemic has forced us to see and face hard, difficult truths, it's also brought an urgency and a courage to make bold moves in a build-as-you-deliver healthcare transformation sprint, one that, in crucial, compassionate, holistic ways, saw nurses fuel and lead. And it's critical that the momentum and consequential gains of nurse-led innovation not be lost, that they are urgently shared and celebrated with leaders, decision makers, and change agents to be swiftly and confidently ushered into organizations, adopted in our practice, and benefiting our workforces. And that is precisely the intention and opportunity of one well-researched and authoritatively written report. In this fourth episode of our Reporting Power series, we're centering on the Accelerating Nursing Transforming Healthcare Report. Inspired equally by the pandemic's tidal wave of anguish and innovation, and published as a collaboration between Johnson & Johnson, the American Nurses Association, and the American Organization for Nursing Leadership, this report, with its stories, data, and timely body of research, brought into sharp focus nurses' pivotal role in rapidly deploying innovations in care delivery, organizational structures, and our healthcare workforce. The report is written with a determination to preserve the advances in innovations and accelerate the momentum and transformation toward our preferred, more equitable future, even while we are still responding to the challenges of this pandemic. Early in the COVID-19 pandemic, it was common to hear, the virus is the great equalizer. However, the stats of this global public health crisis quickly revealed that's not the case, that there are stark inequities in access to even the very basic and primary healthcare services. This is especially true for the transgender community, who have been uniquely affected by the pandemic in several ways, including a higher risk of exposure to the virus and its adverse outcomes, delays in access to gender-affirming care, and diminished access to mental health care and social support, which is crucial to protecting against the effects of stigma and discrimination.
Hi there, my name's Dallas Ducar. My pronouns are she, her, and hers. I am the founding chief executive officer of Transhealth Northampton. I'm a researcher, I'm an educator, I'm a nurse, I'm an advocate, I'm an activist, and I really want to revolutionize healthcare and build novel systems to provide holistic, empowering, affirming care.
In this episode, we take a close-up look at how a mission-driven healthcare clinic and their representative care teams have innovated to meet a full complement of health and life care needs of the trans and gender diverse community, and in the process, helped build the playbook for healthier experiences, outcomes, and affirming care for all of us.
Transhealth Northampton is a groundbreaking, independent, and comprehensive trans healthcare center built to empower trans and gender diverse adults, children, and families. Throughout our history as a community, trans and gender diverse people have looked to each other for healing, support, and affirmation. Transhealth Northampton honors that by providing comprehensive and professional healthcare as we have opened our doors to trans and gender diverse individuals and their loved ones. As a trans-led organization, we are uniquely positioned to expand healthcare possibilities for our community. Through research, expert care, and fierce advocacy, we work to secure a healthy, affirming future for all of us.
So, Dallas, the Future of Nursing 2020-2030 report, the subtitle is Charting a Path to Achieve Health Equity, and the Accelerating Nursing Transforming Healthcare report. In all of these studies, the recommendations that come out are talking about how important the role that nurses play is in helping us achieve health equity. When you're looking at these reports and the recommendations that they provide, how are they helping you to innovate or to give you the evidence or the encouragement or catalyst to say, we need to be doing this?
Well, first and foremost, I'd say we really have the power as nurses to be able to change healthcare. This starts by not only living our own values, but also holding nursing as a profession to its values. And we are the strongest, most trusted, most populous healthcare workforce. And I believe that all of these reports really highlight the importance of that change. So when we think about health equity, we think about how do we remove barriers? When we think back at what it takes for trans people to just be able to get access, there's so many barriers, whether it's the paperwork, whether it is having the requirement to go see certain providers or be connected to certain type of health resources. And so we really have to be thinking about access to care. And when we think about access to care, who's closer to the patient than the nurse? It's really removing barriers to access and making sure that we have an expansion of an informed healthcare workforce too. And that means being able to meet them where they are. But then that also means just expanding the number of providers in the country in general. You know, policymakers need to expand the scope of practice for advanced practice registered nurses. This includes nurse practitioners and other types of advanced practice nurses as well. We also need to remove institutional barriers such as telehealth and restrictive workplace policies too. And one thing that we've been doing at Transhealth incessantly has been to expand telehealth in general and to really be able to increase access to care. For Transhealth Northampton, there's an estimated 20,000 trans and gender diverse folks in our catchment area, in a rural catchment area. And this is in New England, so the states are relatively close to each other, and the divided nature of healthcare based on accessibility makes it really difficult to see patients who are in need of it in the most rural settings. Focus groups that we conducted in the area found that the most talked about challenge identified was the lack of access to reliable transportation, which many times leads to deferral of care and sometimes leads folks to have to go see a different provider that's not gender affirming and increase the chance of discrimination. And so really, we need to expand access to compassionate care. And there are some bipartisan pieces of legislation right now, such as the TREAT Act, that suggests that Congress has both the authority and possibly the political will to waive licensing requirements and expand telehealth. But at the end of the day, interstate licensure issues create a barrier for patients. And what happened in the past couple years during the COVID pandemic was we saw so many states expand telehealth temporarily and then restrict it. We've never seen a more unilateral restrictive action, at least in Massachusetts, to restrict access to care for folks in other states. And there was no reason to do that when it was working so well, especially in a place like New England. And so this drastically has reduced the availability of care for our most marginalized, specifically trans patients of color in rural settings. And so we just need to align healthcare access. That's just one example, but I can speak to many others specific to nursing too.
Sounds like we had a really good experiment, a good trial to see, did this work? Did it improve access? Were there problems? And we didn't see that. So it is really hard to understand why those regulations that were relaxed weren't made permanent.
Yes. And it breaks my heart to think about those kids that say were going to college at Smith, for example, that then had to go back home to another state and were not able to continue receiving gender-affirming care. Or it breaks my heart to think about folks that are just over the border and very rural in New Hampshire, and Transhealth could very easily see them. But it's because of these antiquated laws from the Civil War that we actually are unable to just see patients that are closer to than, say, Boston, for example, which is in the state. It doesn't make sense.
That's a perfect example of where we see how technology can really solve a problem, and we need a policy to come along with it.
We do.
So Transhealth Northampton, if I were just looking at it and going to visit your website, I would see here is a healthcare practice, and it is built on some really important pillars around making sure that I get the care that I need, from people who understand my needs, my challenges, and anybody who is looking at it may not appreciate the depth and the breadth and the special characteristics. So when you talk about saying comprehensive healthcare experience that empowers trans and gender diverse adults, children's family, what's it like to receive care in your practice?
Well, what that really reminds me of is a review that was actually left on our Google Maps of all places, where someone had said, they didn't even realize that they had experienced discrimination in the medical field until they went here. And they were treated with utmost respect as a non-binary individual. And to me, that just hits home on so many levels, right? We know that there are rampant levels of discrimination that occur in the medical field. A recent report from the Center for American Progress said that nearly 68% of trans people of color reported discrimination. That's most trans individuals experiencing discrimination in a primary care setting or in any other clinical setting. But when you experience discrimination in a primary care setting, you're much less likely to then go back there or show up for urgent care. You might wait, and you might wait till you're in emergency care. And that initial discrimination has had a compounding effect where someone's morbidity and possibly the chance of mortality has increased. The healthcare costs have increased. And this isn't just preventing some exacerbation in a health condition, but it's really just affirming people. It's ensuring that people can be known. So what is it like to receive care in this space? You don't have to be seen as different. You don't have to explain yourself. Instead, you can come in, just be able to breathe easy and be able to see yourself reflected in your providers, in the nurses, in the various different staff members. It's not just about the clinical care.
Mm-hmm.
It's really about feeling like you can be a part of building a home. And so along with receiving care here, along with receiving mental health care here, whether that's psychiatry or therapy, we have community services too. And we're working to offer makeup classes and hair classes, weightlifting classes, tax preparation classes, whatever folks need. Along with that clinical stuff, it's really about creating a space that doesn't actually feel clinical in nature, that feels like a space that you can call home.
The description that you provide sounds more like comprehensive life care. And yes, there are going to be some healthcare things along the way too. And we're here to help you with those. You used the word and made the description that trans people experience discrimination in healthcare. What are some of those examples? When somebody says, I had a care experience that included discrimination, name those for us.
When we talk about discrimination, there are countless examples of discrimination. It starts in terms of not being able to be seen first and foremost. And that means just not having the right name or pronouns used. When people don't acknowledge pronouns or don't acknowledge someone's name just to start with and are not acknowledging someone's identity, it can mean that people are outed right there and then and that they don't feel safe. There's also the compounding impact of when people are refused care. Then all of a sudden you have a situation where people can be denied care. They end up, for many, experiencing discrimination in other parts of their life. Because Shauna, when discrimination happens in one part of life, say in healthcare, and someone's unable to get access to healthcare, it compounds to other parts of their life, to housing discrimination, to employment discrimination, to any type of public accommodations. And there are some states that will protect against discrimination, but even in states like Massachusetts that protect against discrimination, that doesn't mean it doesn't happen. And unfortunately, what that does is it can cause so many people to live in fear for their life, in fear of actually letting others know that they are trans. And so then they may not report it. And when they don't report that they're trans, especially to clinics that should be collecting this data, which is called SOGI data, or sexual orientation, gender identity, and intersex status, when it's not collected, then we don't have a number, an actual estimate of how many trans and gender diverse folks or those with intersex traits actually exist in the country. And if you can't count people, then they don't count. There's not a way to allocate resources there. There's not a way to allocate funding there. And then that perpetuates a cycle of discrimination because you don't have the resources needed to do the proper education, the training, or invest in research or appropriate clinical care, which then unfortunately causes some of this work to really get siloed to specific places, to become inaccessible to many. It also has the unintended effect where perhaps binary folks, they have the choice at least to out their own selves or not. But for many non-binary individuals, they don't have that choice. And many non-binary individuals experience high rates of discrimination in medical care settings and clinical care settings. And then when you overlap that with also racial or ethnic discrimination or discrimination against disabled individuals, you come up with a system that really only cares for individuals that fit a specific mold. And that's a very myopic system. The 20th anniversary of September 11th happened very recently. And September 11th marked a moment in American history when the government expanded its own surveillance power beyond the scope of what Americans have ever experienced. Since then, we've seen technology and procedural systems develop that affect people disproportionately because of their gender, because of their race, because of their ethnicity. We've seen Muslim individuals, along with other racial and ethnic minorities, overtly profiled, harassed, and unable to travel freely. And our new systems of hypersurveillance really often lead to traumatic experiences for millions of transgender Americans who have to walk through body scanners yearly while a TSA agent stands there and guesses their gender. And people can expect humiliating, traumatizing ordeals in public. Recent investigations from ProPublica showed that many trans folks are subject to these invasive and unwarranted screenings. And really, this is an example of a system. And what does this have to do with discrimination? What does this have to do with the way we construct systems? Well, the DSM, for cisgender individuals, hormone replacement or puberty blockers are easily accessible. They're used to treat precocious puberty. Hormone replacement therapy has been beneficial for a numerous amount of endocrinological and cardiovascular conditions. And yet trans and gender diverse folks are burdened with so much paperwork, different psychiatric assessments, different insurance pre-authorizations, and in some spaces, providers still require individuals to present as a certain gender. So these systems intentionally create gaps in care and then lead to overt discrimination down the line that start in healthcare, but really move outward to many different settings where, people have died in the back of ambulances because EMS has refused to treat them, or there's cases where people have lost their insurance because they're trans and then been unable to access hormones and had to live on the street and had to retransition from female to male just to keep themselves safe from assault. And so this is a system that leads to discrimination. And I truly believe that systems that are built to advance gender-affirming care are so important and need to be inclusive by design. We need healthcare to be that space of liberation, not discrimination.
I can feel the weight of those stories, and there are people behind each one of those examples that you provided. Thank you for sharing that, because we need to understand it. And it's through these stories and people's experiences that we do have a better understanding and what discrimination looks like, where it happens, and the consequences of it. Transhealth Northampton. What's it like to work in your practice? What's the team like? Why don't you start with yourself? Nurse practitioner, researcher?
Well, I love our team. I think they're so much fun. As the CEO of the organization, I try to get out of people's way, and I really try to let them do what they do best. It's so easy, Shauna, when starting an organization to want to have your hands everywhere. And I think the most amazing thing to see is when you let go. You'll just be so amazed with what people put their minds to and what people do. And we really just have a lovely team that's able to do that and envision from their own experiences the type of care that they would want to receive too. For myself, my day-to-day is oftentimes meeting with our leadership team and really trying to understand what's blocking us, what's also propelling us, where are our pathways for opportunity, how do we really be able to reach the end goal, which is expanding gender-affirming care. And I think one of the things that I really try to remind individuals of frequently is what are our values here? But then very practically, we have monthly startup days to work on collaborative problem solving together, where we spend, 4 hours throughout the day and just trying to solve the problem at hand. We have community time once a week that is 4 hours as well, where people can work on projects about the community, for the community, with the community, and really build new ideas and momentum. Our nursing staff, and myself too, being a nurse practitioner, but really everyone here, we want everyone to practice at the top of their license. And in terms of innovation, we have been the first practice to push this model of nurse practitioner autonomy, especially right after the Full Practice Act was passed in Massachusetts. And while that's still being implemented, what we have been able to do is have our nurse practitioners paneled as primary care providers, which is the first time that has happened in this area. And so our internal momentum to ensure that people are able to be independent and practice independently then has outward ripples. But also, many of us are coming from spaces where we've experienced our own form of what I would call medical trauma, our own form of being that person that's been out there trying to be the biggest advocate that we can, trying to change the system and being a lone voice, and really feeling like people in the organization just don't want to hear you. And we've really had to take time to ensure that we don't re-traumatize each other, because we're so used to being in those environments sometimes, thinking that we're actually fighting against someone within, versus instead remembering we're all on the same team. We also have a budget that is completely transparent, that we 4 times a year, and anytime anyone requests, walk any staff member through our budget, why we made certain decisions, and really thinking about the implications of justice here and how we actually are able to make sure that we are held accountable in spending the resources that we have. At the core of all this, especially in a mission-driven organization, you have to have humor. And I think that's one of the things that I appreciate most about our team is people are just so funny and able to laugh with each other when things might seem absurd or strange or pushing up against something. It's just so important to be able to laugh.
It's incredibly therapeutic.
It really is.
So many of the situations that we find ourselves in or taking care of or, walk through the door, common phrase that I use in talking with people, like, you cannot make this stuff up. You just can't. and when you have colleagues who can bring themselves to it with compassion and a sense of humor, we can all get through it together. And so I love to hear you say how important humor is to the team and to the care. That's I don't get to hear that very often. One of the parts of your practice that's wonderful in an unusual way is that you really have incorporated research and using real world data and valuing that. To your point, if we're not visible and we're not counting, then we don't understand the need or the problem, and we're not creating solutions or policies that are needed. One of the things that you have mentioned is how important it is to have patients and families and communities involved in all of your research. How are you including research and academics within the practice? Because so much of these reports have made the recommendation that nurses do need to be leading this research. And in our education, we need to be understanding more about the equity issues and practices that help us achieve health equity. So that's a long way getting to this question of how are you incorporating research and education in your practice and including patients and families in it?
It's a great question, Shauna. Well, I'd say the base of this cake, right? The base layer here that's going to hold it all up is our clinical care. And if we don't have that expert clinical care, we will not have the trust of the community. And if I don't know what Transhealth Northampton is, especially from first-person experience, I am not going to go participate in some research study. I am not going to go sit on some education panel, right? And so the first and most important thing is to be able to have the trust of our community through expert clinical care and through the partnerships that we create and that help hold us accountable as well. I want to be so intentional with how we proceed with our research. And specifically, that means the creation of the nation's first all-trans IRB, Institutional Review Board. And that's what's in process right now, is finding trans and gender diverse folks from across the country, assembling them on a board, bringing them together, and being able to really create a new way of doing research that is ethical, that is informed, that is rooted in our community, essentially that is nothing about us without us. And we're in the latter half of actually getting all those people together and getting the IRB up and running. And once that is there, then we can say our community has been able to sign off on this research specifically. Our community says this is why this is valuable versus being researched on, we can research with. The same for our education too. There have been medical schools and nursing schools and so many different places saying, we want to get in here. We want to be able to really get our students in here because this would be a great clinical placement, which I understand it would. But we have to be really intentional about what the patient experience will be here and how we create that home. And that means, what students do we want to bring in here? Do we want to bring in the experts? Do we want to bring in the people with lived experience? Or do we want to bring in the folks that really haven't been exposed to trans folks before?
Or all of the above.
Or all of the above, yes. Both and.
Yeah. So following along on what you were saying, and thinking about being so thoughtful about next steps, how we're learning as a community. As a trans-led organization, you really are uniquely positioned to expand all these healthcare and life possibilities for the trans community. But also it's really a blueprint and a playbook about how do we improve care for other communities who have not had care that was designed or delivered specifically for their characteristics or their conditions or their climates, their needs, their circumstances. Just so many different ways that we need to think about care that is contextualized. What are some of those general principles that somebody else who's listening to this and saying, here's the group that I care about? What would you provide as principles for them to start innovating to deliver care that helps achieve equity for the community that they're a part of or that they care about or we haven't done a good job on?
Well, I would say first and foremost, I, as someone who is just very rooted in values, I went back to nursing values and specifically looked at values like justice, right? And how we as a practice would ensure fair treatment of others and equitable allocation of resources. That comes to play in terms of non-discrimination, human dignity, this inherent inalienable value of each human that cannot be taken away. Starting there, there's autonomy. So consent. We wanted to create a space where everything was being consented to by the patient, where they were informed as possible. So we start with all these values. And then once we have our values, we then say, okay, so what does the community need? And we went back to this large catchment area across New England and went door to door, went from provider's office to community center to family group, distributing surveys saying, what would you want in your most ideal health center? And what are your needs? And they weren't that different than what we had thought, but we really wanted to listen to the community's voice. So we start with this value-based approach. We then move into this principle of listening to the community consistently in an iterative fashion. And then from there, it translates to patient-centered care. And I think if these values, and specifically patient-centered care, were to be applied in any other context, you would end up with a similar care experience, what I would call an affirming care experience. This is not specific to gender. We can have affirming healthcare anywhere. And the gains of gender affirming healthcare are that we've been able to have healthcare that is shaped around the individual, but that by no means is specific to the trans and gender diverse community.
You make such an excellent point, because what we're learning in this affirming type of care, people show up with so many identities. So affirming care, your practice and the trans community is doing such a good job for us to think about just people and person-centered care. How do you show up, and what do you need, and who is the best provider for that?
I would just say that, yes, it is patient-centered care. It is affirming care. It does allow us to care for every part of one's life, at least in gender affirming care that intersects with gender, not just bathrooms and workplaces and schools, but so much more. And in the same way, affirming care is being able to care for those complex, disparate, different parts of one's life. In short, it's what nurses do best. It's being holistic, right? And it's really working to create a healthcare system that is responsive to one's identity versus having people try to respond and fit themselves into a healthcare system. When we talk about Transhealth Northampton, and when we talk about healthcare, what I really want to see here is I see this as an opportunity to push the bounds of what healthcare can be. I really believe that this is gender-affirming healthcare, and it offers a model for all of healthcare. I believe this is really a profound expression of patient-centered care. It's one that's based on the human story, though, not based on what the provider says the healthcare should be. One that's been shaped really by an active, informed, and vocal patient population that has unfortunately had to learn out of necessity to demand rights, be seen, and to be cared for. And so we should really be expansive here when we're thinking about spaces that allow patients to show up, but also when our patients show up, when our patients get to be honest, when our patients get to be curious about who they are. This also creates space for healthcare clinicians and staff to be themselves, to show up, and inevitably reduce burnout. This is the healthcare we all strive for. This is one of authenticity.
Well, I am so glad you used that word, burnout. Every single report, and there are many, they've surveyed many nurses, there are many academics that are reviewing, a lot of rigor around it, but there's not a single one out there that doesn't make the recommendation of how important it is to support the health and well-being of nurses, of our clinical staff, of all of the healthcare workers who are patient-facing and providing the direct care. Dallas, your staff, your clinical team, how are you taking care of them? How are you supporting them? Because not only as care professionals, they're going to experience that, but then also because your practice is the trans community, they've probably also experienced some really difficult situations.
Yeah. At the very beginning of Trans Health, I wanted to make it very clear that self-care was part and parcel of the care we delivered, that we could not show up to work and provide this type of care if we could not actually care for each other. Really think about when we're using the term burnout, and perhaps instead use the term powerless. And to think about, do we really mean burned out? Or do we mean that we're unable to affect change? And I wanted to create a system where everyone was able to affect change and empower each other. So whether it was how we developed our workflows, whether it was where the light fixtures went, whether it was how we designed the signs, to tough decisions like closing a wait list temporarily. They weren't always easy, but when you get people to the table and you get people talking to each other about mutual decisions, then we can at least speak honestly about them, and we can at least feel more empowered at work, while at the same time really being able to show up authentically because you're able to build that space together.
When you hear, titles around charting a path to health equity or achieving health equity, how are you defining that? How are you innovating toward it? How do you measure it? And what does the success of equity look like or feel like?
Well, to me, providing equitable care means really providing individualized care, knowing that there's not a one-size-fits-all model. We need to also be providing equitable care that ensures access to care, whether it's through the telehealth that we talked about, whether it's through a mobile clinic that we're working towards, whether it's through satellite clinics that we're also working towards. It means offering affordable care, right? So much of gender-affirming care can be seen as out of reach or only afforded to few. And so really having policies that enable the folks that cannot afford a certain type of care to be able to receive financial help. But I think what's perhaps most important in my mind in terms of achieving health equity is hiring staff that are representative of the most vulnerable communities that you serve. And if you can't find those staff, if you're having trouble hiring them, expand the hiring process, invest more money in it. And if that doesn't get you anything, then create scholarships, right? Create systems within your own space to be able to lift people up, because it's when you have spaces that are really staffed by some of the most vulnerable folks that you're able to really address those very individualized needs that are just don't need to be surveyed over and over again. They need help.
That is a tweetable meme. That needs to go like on a cross stitch or a bumper sticker, a t-shirt. Yeah, I love that.
The amount of times I hear from trans folks that they're tired of surveys. They don't want to be asked what they need. They're going to say the same thing over and over again, right?
You have enough information to go on. Just build the plane while you're flying it. And it sounds like that's what you're doing, is just build the practice while we're delivering it.
That has been our motto, is build the plane while we fly it. And could we just act versus even asking some of these questions? So the data is important, but when you already know the answer, just help people.
Dallas, you have so many strands of activity that weave into this incredibly captivating story. And you're really generous in sharing and revealing who you are, your thinking. You do that through research, through your practice, through your writing. But how do you introduce yourself and share your work so that people know how to connect with you and how to learn from and with you?
Ever since I was a kid, I have always been fascinated by very big questions. Why are we here? What are we doing? How do we live the best life that we want to live? What gets us out of the bed in the morning that we're in love with? And at my heart, I really view myself as a philosopher. And I understand that's probably not going to connect with everyone. Not everyone loved their college philosophy courses, perhaps. But to me, philosophy is the lover of wisdom. It's someone who just asks questions. And fundamentally, I see philosophy as the base layer for everything that we do, the healthcare systems that we build, the businesses that we create, the activities that we engage in, the ways which we vote. And from a very, very, very young age, I knew that something was not right in my own body, in my alignment with my own sense of self. And it took a long time to be able to find the words for that. And I would say I'm still finding words for that. But that all started with being able to ask questions and being able to be genuinely curious about the world. And I think that when we're able to ask ourselves questions, then oftentimes that comes back to how do we help others? And I am very much interested in how we effectively help other people and also create spaces where people can help themselves and come to better understand themselves.
And so how does that weave into how you professionally introduce yourself and the work that you do, the care that you provide, the roles that you have taken on?
Well, I would say that I never thought in a million years that I would be in a CEO position. And really as a leader in this space, as the CEO of Transhealth Northampton and founding a groundbreaking, independent, comprehensive trans health care center. But that also shines through, I think, in research and trying to be able to better understand the needs of trans and gender diverse folks, trying to establish spaces where communities can gather through advocacy and getting involved on state, regional, federal stages, and ensuring that those values of justice, of equity, of human dignity are able to be manifest in policy.
Nurse practitioner and activist Dallas Ducar is the CEO of Transhealth Northampton, a groundbreaking trans-led comprehensive healthcare center that's also built to empower trans and gender diverse adults, children, and families. Through research, expert care, and fierce advocacy, Dallas and her team work to secure a healthy, affirming future for all of us. And she means all of us, even those providing care. In building gender-affirming care practices, Dallas makes an important point that what we're striving for is affirming care or person-centered care. That when our patients get to be curious about who they are, it also creates space for healthcare team members to be their full selves in how they show up. And inevitably, that reduces burnout. This is the healthcare we all strive for. This is one of authenticity. I hadn't really thought of our diversity as an important part of our well-being and a buffer against burnout, or what Dallas more accurately identifies as powerlessness. In her practice, research, and advocacy, Dallas draws on psychology, philosophy, and the lived experience of her patients, her colleagues, and the queer community to foster belonging, excellence, justice, and a sense of humor, all while pushing for transformation and equity in how we deliver care and who delivers care. In case you missed it, be sure to listen and share the first 3 episodes in our Reporting Powers series, Rehearsing the Future, where we dig into the ambitious nature of the Accelerating Nursing Transforming Healthcare Report, Insights in Action, a listening adventure of beautifully told stories revealing how the pandemic changed access to care, changed care needs, and impacted the well-being of the healthcare workforce, and Provide, Protect, and Invest, a conversation with the mind behind the innovations in retail healthcare. In each episode, we gain a better understanding of just how nurses are accelerating nursing and transforming healthcare. For See You Now, I'm Shauna Butler. Thanks for listening.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.